Good morning. This is Gio Valenzuela reporting live from VN64 News. Today, me and my partners Barbie and Mariah will be discussing anticoagulants. Anticoagulants are drugs that thin your blood. Now, different kinds of drugs that classify under anticoagulants affect your blood differently. Today, we'll be discussing 6 of them. I'll cover 2, and I'll pass the rest on to my partners. Now, I'm going to be talking about Pradaxa and Xarelto. Let's get right into it. Pradaxa is an anticoagulant that works by blocking the clotting protein thrombin. It helps stop blood clots that can be caused by arterial fibrillation. Preventing these blood clots helps reduce the risk of a stroke. Now, the next drug is Xarelto. This one's a little bit more different. Xarelto is used to prevent blood clots from arterial fibrillation as well, but it is also used 6 to 10 hours after surgery, like a hip replacement or a knee replacement. It is used to prevent deep vein thrombosis or pulmonary embolus. It is also used to prevent previous blood clots from forming again. On to you, Barbie.
Thanks, Gio. Those are 2 great anticoagulant meds. I'm going to share with you 2 anticoagulant medicines that I am more familiar with, warfarin and enoxaparin sodium, also known as Coumadin and Lovenox. Let's start with Coumadin. It's most popular of the anticoagulants and the one used the most. It comes in tablets and also IV. You take it for AFib, pulmonary embolism. You can also take it for prevention of myocardial infarctions or heart attack, and also after something like this has happened to keep it from happening again. You shouldn't take it if you have problems with bleeding, open wounds, or are pregnant. And some of the possible side effects are bleeding, hemorrhage, and leukopenia, which is low white blood cell count. You're going to need to be monitored by your doctor for your PT and your INR numbers and your liver function. You also want to make sure that there's no bleeding and bruising that you have that's unusual. If there is, you need to tell your doctor right away. You also don't want to take NSAIDs or ibuprofen, aspirin, because those can make your blood even thinner than these anticoagulants can. You also want to stay away from grapefruit and vitamin K, because those can interfere with your absorption of all of your anticoagulants and making them not work correctly. Usually doctors prefer to hold this medication before surgery so that your blood is not too thin while they're doing their job. And it usually takes 5 weeks for this to take effect to make your blood as thin as they would like it to. So the other one that we have is Lovenox. It works a little bit quicker on your blood than the warfarin does. And it comes subcutaneous injection, so usually it's just right under here, or you can stick it in your stomach as well, just right into that layer of skin right underneath, but before your muscle. You're going to take for prevention of thrombosis or blood clots, pulmonary embolism as well, or most commonly they give it to you after total knee replacement surgery. You shouldn't take it if you're sensitive to heparin or sulfites, benzoyl, alcohol, or pork products, and also if you've had active bleeding or have that problem currently. Some of the side effects can be stroke, irregular heartbeat, heart failure, and bleeding. So your doctor is going to monitor your blood count and your platelets to make sure that it's working correctly and that it's not too thin and not too thick. You also want to watch for signs of bleeding and bruising with this medication as well. It may occur a little bit, but you want to make sure that it's not out of control and that it's not super unusual in places it shouldn't be. You're also going to watch for fluid retention, make sure that your arms, legs are not swelling and that you're able to get out as much in fluid as you're taking in. And you're going to promptly report to your doctors if you have an irregular heartbeat or you have that unusual bleeding or bruising. So those are the 2 meds of anticoagulants that I am the most familiar with. And now we're going to take it to Mariah, and she's going to tell you about 2 more. Mariah?
Hi, this is Mariah reporting to you live to talk about 2 more anticoagulant drugs. So the first one I'm going to be talking about is apixaban, also known as Eliquis. So the dosages for this drug are 2.5 milligrams and 5 milligrams, and the indications for this drug are stroke, prophylaxis, atrial fibrillation, DVT, and pulmonary embolism. So this drug is taken by mouth, and one main adverse reaction you should be looking for is bleeding. Lots and lots of bleeding. And you should not be taking this drug if you've had past thrombic events, and it increases your risk for hematoma. So the second drug I'm going to be talking about is heparin, and the dosages for this drug range from 1,000 to 20,000 units, and this drug is by injection. So always remember to wipe it before you poke it. So the indications for this drug is pretty much the same as the first drug. It's DVT, acute coronary syndromes, and pulmonary embolism. So you should not be taking this drug if you've had a history of heparin-induced thrombocytopenia. And also the side effects that you should be looking for are hemorrhaging, which means also lots of bleeding, hematoma, and anaphylaxis. Okay, thank you for watching, and always remember your 6 rights.